All right, could you raise your right hand? Do you solemnly swear or affirm the testimony you give will be the truth and nothing but the truth, so help you God?
I mean,
All right, you can lower your hand. Just keep your voice up so everyone can hear. If you'll state your name for the record and spell your last name, please.
Joshua Lowe, Lowe.
All right, state you may proceed.
Thank you, Judge. Dr. Lowe, how are you currently employed?
I am currently an attending physician at Brooke Army Medical Center. I'm also an associate medical director for Center.
Okay. And can you please explain to the jury your educational background and professional training that qualifies you as a medical doctor?
Yeah, in addition to medical school, I'm board certified in emergency medicine and fellowship training in pre-hospital medicine and disaster medicine.
Okay. And are you licensed to practice medicine in the state of Texas?
I am.
And how long have you been licensed?
In the state of Texas, I've been licensed for 2 years. I've been licensed as a physician since 2018.
And what does your practice consist of there at BAMC? Is that like an acronym for Brooks Army Medical Use?
Yes, ma'am. So BAMC is one of 2 level 1, which is the highest level trauma centers, not only in San Antonio, but in all of STRAC, the Southwest Texas regional.
All right. And so as an attending physician, are you there in the ER?
Yes, ma'am.
Okay, and you guys receive income traumas?
Every day.
All right. Now, were you employed as a medical doctor on October 19th, 2023 at BAMC?
I was.
And on that day, did you receive a patient by the name of Nicholas Anton Swain?
I did.
Okay. And can you describe the condition that he was in when he arrived in the emergency room?
He was brought in by San Antonio Fire Department directly into one of our 2 main trauma bays, and he had a gunshot wound to the inner right thigh with 2 tourniquets in place. His pants had already been cut by the paramedics, and he had a bleeding wound from his right wrist.
Okay. And upon arrival, was he in stable condition, or how would you describe his condition?
He was in stable but critical condition. By that point, he had already had the 2 tourniquets in place to stop the bleeding and had received most of a unit of whole blood from the fire department. His blood pressure was low and his heart rate had gotten high at that point. He was in what we call shock, hemorrhagic shock.
Okay. At some point during his treatment, did you have to oversee life-saving measures?
Yes, the entirety of his care or his treatment under my care was life-saving.
Okay. And at some point, did he have to be resuscitated?
Yes, ma'am. The entirety of his care under my treatment was resuscitation to get him stable enough to go to the operating room.
Okay. Now I want to talk to you about the gunshot wounds that you described. So regarding the gunshot wound to the right leg, can you just explain to the jury what major arteries are contained in the right leg?
So when he came to us, we took the tourniquet down to make sure that there was arterial bleeding, and there was, which is pulsatile, and we put the tourniquet back up. Our initial concern was that he hit the femoral artery, which is one of the major branches coming off of the aorta. You can bleed out in 2 to 3 minutes from that. They found later in the OR after opening it up that it was the popliteal artery, which is a major branch off of the femoral artery.
And excuse me, if you could spell that artery for the court reporter, please.
Popliteal is Popliteal.
At this moment, the courtroom hears from a trauma physician who has seen the line between life and death far too often. Dr. Joshua Lowe explains how a single gunshot wound to the leg can trigger catastrophic blood loss within minutes. What sounds clinical is, in reality, a race against time where survival is never guaranteed.
And that one is a little bit smaller, but you can bleed out in about 10 to 15 minutes.
And then regarding the wrist wound, can you just describe what that was? It a through or what risk presented from the wrist?
Yeah, honestly, he got kind of lucky with that one. It completely missed both bones and went right through the middle. It was through and through. If it had been a millimeter to either side, it could have caused a lot worse damage.
Okay. Regarding what would be the normal heart rate for an individual such as officers in healthy condition?
Normal heart rate would be anywhere between 60 and 85 or 90. Someone of his age and stature.
Okay, and so someone or his pulse being at 35, what did that indicate to you?
Given the context of it, of the bleeding, he was likely in what's called stage 4 shock, which is the most grave form of shock. Which is after, when you start losing blood, your heart tries to keep the cardiac output up by making your heart rate go up so that it maintains the same. And he was starting to trend down at that point, and was well below where it was.
Okay, now, this downtrend, was that caused due to blood loss that he was feeling?
Yes, ma'am.
And do you have an opinion as to the whole blood transfusions, impact on him?
Absolutely. I don't want to say it was lucky, but he was lucky that this happened in San Antonio. We're one of only a few cities in the country that have whole blood in the field. By the time he came to me, he was already back into stage 3 shock, and his heart rate was up because of the blood he received in the field. I don't know what would have happened if he hadn't received that blood.
Okay. Now regarding the injury to the right leg and those arteries that you were describing, did injury to those arteries present like risk factors going forward?
The arteries, there's always a chance for scar tissue to form and for him to get decreased blood flow as he gets older. Honestly, the injury to the vein, which wasn't as bad in the moment, makes for the worst long-term outcomes. He's at an increased risk for the rest of his life of developing what's called a deep vein thrombosis, which is a blood clot in the leg that can break off and go to the heart and to the lungs.
Okay, and is that deadly?
When it goes to the lungs, it can be.
We talked about this.
Defense?
Thank you, Judge. Did you do any follow-up with Officer Swain, or is it like your time with him is just the emergency room time?
Right, yeah. I'm an ER doctor. The follow-up is usually done by the trauma surgeons and then the physical therapist.
Okay, and so your time specifically was treating him in the emergency room and then passing him on to surgeons once he's stable. Is that correct?
Stable enough for surgery, correct.
All right. As an ER doctor, wanted to see if you could answer some questions that have some potential relevance in this case.
Absolutely.
As an ER doctor, you certainly have to treat head injuries sometimes. Would you agree with that?
Yes.
Are you able to answer just general medical questions about what happens when a person has, what potentially happens when a person has a head injury so severe that they're unconscious for some amount of time, more than a few seconds for sure? Like, is there a term when a person's unconscious for more than a few seconds?
Traumatic brain injury, depending on the level, it can go from mild, such as a concussion, to severe, which could be life altering.
Some people recover from head hits so strong that they're knocked unconscious for some amount of time. Do you agree that some people recover and seem to have no lingering effects?
Correct.
Are there some effects that are sometimes subtle and very maybe nuanced?
Depending on where the injury is to the brain, you can have ongoing lingering damage that and can worsen with secondary impacts or low blood sugar, things like that.
Is there certain medical and psychological testing that sometimes can test for whether a person seems to have some deficits from potential brain injuries?
There are. The military specifically uses something called an ANAM, A-N-A-M. I don't know what that stands for, unfortunately, but they give it to all of our service members before they deploy, and then after. It's more of a trend. I can't tell you if you've had a head injury based off of those tests, if giving it to you once in time, but by giving you 2 separate tests in time, I can tell you fairly confidently if you've had a head injury in between those 2 tests.
All right. And as an emergency room doctor, do you oftentimes have to see people where you learn that there could be clinical depression involved in a person's mind?
Yes, sir.
And as a doctor, let me ask you generally, like, is depression sometimes misunderstood as just, like, hey, toughen up? Like, you know what, let me ask it to you this way. Like, if somebody has a cancer diagnosis, people usually take it immediately pretty seriously, and it can be, it's hardly ever understood.
As testimony shifts, the focus moves from physical trauma to the invisible injuries of the brain. The doctor explains how traumatic brain injuries can quietly alter judgment, behavior, and emotional stability. Some effects fade, others remain hidden for years, shaping decisions in ways even the injured person may never fully understand.
Stated, like something like that. Would you agree?
Correct.
Is there a difference, like when some people say, like, oh yeah, he's depressed, where people kind of say, like, oh, toughen up? Is that just something you see in society?
Specifically in the military, which is where I do 80% of my job, yes, there's a stigma around mental illness. On the civilian side, I feel like over the last couple of years, it's gotten less, but it's still there.
When a person is clinically depressed, like, what does that mean? Like, how is that different than just like, hey, I'm having a bad day? What's the difference between having a bad day where somebody hurt my feelings versus a person who's clinically depressed?
So by definition, in the DSM-5, clinical depression has to be going on for greater than 2 months, and has to have a negative outcome on the patient. The patient has to feel that it is affecting their life. If it's not going on for at least 2 months, and if the patient does not feel anything bad about it, then it's not clinical depression. It has to meet those two criteria.
Are both depression and potential brain injuries the kind of things that can affect somebody's judgment or decision making medically?
Yes.
All right. Now, I'll pass the witness.
State.
Just briefly, Dr. Remote. So hypothetically, not hypothetically, in practice, traumatic brain injuries tend to get better over time in most instances. Is that correct?
They at least reach a level plateau. They'll reach a point to where they get to a certain point where they've gotten better, and then they'll plateau. They don't tend to wax and wane.
Okay. And so if somebody did suffer or sustain a traumatic brain injury, those symptoms that they were experiencing from that, would they show sometimes and not other times, or would it be persistent?
For the most part, it'd be persistent. There are some things, depending on the part of the brain, severely low blood sugar, infection, things like that, where there's already stress on the brain, can manifest itself as a little bit more, but for the most part, they would maintain.
Okay. And so hypothetically, if somebody had sustained a traumatic brain injury 10 years prior, unless there are symptoms that are manifesting, it would be assumed that that was getting better. Is that correct? The injury? Yeah,
unless they had, again, another insult on the brain, infection, low blood sugar, another head injury, they would be at their baseline level by that point or trending up. It wouldn't wax and wane.
Thank you. We properly understand.
Any further questions?
One follow-up on that redirect, Judge. One thing I forgot to ask you is that if a person has one traumatic brain injury where they're knocked unconscious, that can be exponentially made worse if they have another experience where they have a second traumatic brain injury later on in life. Because when you compound brain injuries on top of each other, it can make it exponentially worse, not just like one to the other. Is that
correct? It's the same part of the brain that's hit, then it can get worse. That's how things like CTE in the NFL happen, is by multiple brain injuries.
And like in regard to CTE, the CTE, and can you tell the jury what that is medically?
It's, chronic traumatic.
The discussion turns to chronic traumatic encephalopathy, known as CTE, an illness linked to repeated head injuries. The jury learns that this condition cannot be diagnosed during life, only after death. Subtle personality changes, impaired judgment, and long-term decline may appear, leaving questions that science can only answer too late.
Cephalopathy, multiple injuries to the brain can cause buildup of amyloid plaque, similar to that you would see in Alzheimer's disease. And it's the only way that it can be diagnosed is at autopsy. Can't diagnose it on a living person.
Right. So, and that was going to be my next question. Like I said, it just, if injuries have started to go down that road, you can't tell as a doctor when the person's alive. That's just something that can only be checked after they're passed away and you do an autopsy.
Yeah, there are signs and symptoms. They'll have chronic personality changes, and things that you'd see every day.
And I guess in regards to the NFL players, I guess there's been a lot more research on that over the past few years. But football players who, use their heads and have concussions repeatedly, certainly when they have found out that people have CTE, it definitely affects their judgment in life and their behavior and decision making and things like that. Is that true?
At least the high profile ones. I'm not a CTE expert. I know what I've learned just through the military dealing with people that have concussions. But the high profile NFL players seem to have judgment issues.
All right. Thank you, Doctor. I'll pass the witness.
Just briefly, so when we are talking about these head injuries and them getting better over time, you said that re-injury could kind of cause that progression and healing. Is that fair to say?
That's correct.
And when we're speaking about re-injury, is that like physical re-injury and not like emotional re-injury?
Correct. Physical re-injury, or like I said, low blood pressure or low blood sugar, infection, things like that can cause physical re-injury.
Any preference?
No further questions.
All right, is this witness excused or subject to recall?
You said seer.
And excused by the defense.
All right, the rule has been invoked. What that means is you're not allowed to view anything about this trial or discuss your testimony with anyone until the trial has concluded. Do you understand?
Yes, ma'am.
All right, if you'll remove that square and you're excused. State, call your next witness.
State calls Tiki Oshry.